is Ben, physical therapist at Truve, and today I just wanted to hop on here and do a live Q&A for any questions that you guys may have. So what I'm going to do is I'm going to pull up my phone here so I can see the comments. And so if you have any questions, what I want you to do is just go into the comments and or if you have questions, just go in the comments and ask your question, and then I'll go ahead and answer it that way. However, I had a few past patients and also a few members of Truve reach out to me last night of questions that they wanted specifically answered. So we're going to address those, and I'll wait for the other questions to kind of roll in here. So one question I get a lot is cracking and popping. I'm having cracking and popping in my joints, whether it's shoulder, knee, low back, stuff like that, and whether that's okay or not. So the answer to that is it depends. It depends on the type of popping and cracking and if there's pain associated with it. So one of the ways that we might experience popping is if our joint's been immobile for a while and we go to move our shoulder or move that joint through the range of motion, and so what happens with that is there's a lot of gas that builds up in those joints. Once we move that joint, then that gas bubble or it can be removed, and then we get that popping. The research shows that's nothing to be concerned about. You're not doing any damage to your joints. You're not doing any damage to ligaments or anything like that. So you're good to do that. However, another reason is there can be popping or snapping is when we have tight muscles that are surrounding that joint, and when we go to move our shoulder, a tight muscle or ligament can roll over the structure of that joint and cause a popping or snapping sound. And so with that, it's not, you're not doing any damage to those structures. It just tells me that there's a muscle that needs to be loosened up, or there's a muscle that's tight that could cause issues down the road with regards to how the shoulder or how that knee joint, whatever joint we're talking about, is moving through space. So something that you'd want to be paying attention to and figuring out what's going on there and what muscle's tight. Third one is when there's like bone on bone, or when there's some rubbing going on in that joint. And so a lot of times this is with arthritis, and this is where pain is usually associated with it. So if you're having pain with that popping or cracking, then it's something that you need to be a little bit concerned about and figure out what's going on with that. So in the large majority of cases, it's nothing to be too concerned about. But if you start having pain with it, have somebody take a closer look at it as well. So hopefully all that makes sense. And then also one other fun fact is that just because we're having that popping or cracking sound, it's not going to be causing arthritis down the road. If we crack our knuckles, it's not. The research shows that there's nothing to be worried about with that and increasing our risk for arthritis as we age or down the road. One other question I had last night was getting old. So as I age, is it just normal to have pain with working out? And my answer to that is no, just because pain isn't part of the aging process. It doesn't have to be if we do everything correctly. So, I know a lot of 85-year-olds and 90-year-olds who work out and don't have any pain. I know plenty of 20-year-olds that have quite a bit of substantial pain in their joints in their body when they work out. So there's not a huge correlation between, as we age, we should be having X amount of pain. No. There's on top of that, there's such a large variety of ways that we can modify our workouts to make it so it's not painful. We shouldn't be fighting through pain when we work out. The human body is very adaptable, and we just need to figure out ways to allow you to continue to work out while working around an injury, and then in the process having you do some corrective exercises to mitigate that and whatnot. Let's see here. So hopefully that makes sense too. And then another question I get a lot is, should I be working through pain when I work out? And, because I have the no pain, no gain mindset. So a lot of people do have this mindset that no pain, no gain, and when in reality that should not be the case. So um, we should not be worried on a scale of 1 to 10, 10 being like excruciating pain, like I need to go to the hospital, and 1 is like an itch. We really should never be going above, a 2 or 3 out of 10 with regards to that. Um, but I mean, in reality, we shouldn't be having pain at all. So 3 is the absolute most, but you need to also make sure you're doing something about it in the meantime while you're continuing to work out to decrease some of that pain, and to allow you to continue to work out pain free in the future. Not even up to 3 out of 10. This is like a 0 out of 10 we should be working with. So no, you should not be necessarily working through pain long term, especially. All right. Another question. So stretching before or after I work out, what's the best way to go about that? So this is actually what my doctoral research was on when I was in physical therapy school. Should we be doing dynamic warm-ups or should we be doing static stretching? Should we do a combination? Should we be doing foam rolling? What's the best way to target our muscles and get them properly primed for working out? So what we did is we measured vertical jumps in volleyball players before before and after they did a dynamic warm up for one trial. Second trial was static stretching, and then the third one was a combination of the two. So what we found is that their vertical jump was actually better when they did a dynamic warm up. So what exactly is a dynamic warm up? So dynamic warm up is something or movements that we do that are going to be mimicking the movement that we're about to do for that exercise or that workout. So for example, if I was going to be for these volleyball players, volleyball players do a lot of jumping. So we need to be replicating that in one way or another. One way to do that is through we had them do a light jog, then we also had them do light skipping, light hopping, and things like that that mimic some lunges to mimic volleyball. And so then we also have them do static stretching, and what we found is that their vertical jump was higher and improved more when we had them do dynamic warm-ups versus the static stretching. And then we had to compare our results to what the research that's out already and make sure we were on the right track. And our research lined up exactly with other research that was out there. And so why is that? Why have I heard that, we need to be stretching, before to get the muscles ready? And why should I not be doing it now? So the thinking is, and the reason for it is we have tendons and muscles and ligaments. And when we stretch those ligaments, all right, we lose that elasticity. Just like with a rubber band, if you stretch out a rubber band and hold that for long periods of time, that elasticity is not going to be as great. And so we don't want to be losing that elasticity because it's going to decrease our power output and our ability to perform at a higher level. And so that's what static stretching does. However, is stretching bad? No, we want to be doing that after we work out. So our muscles are going to be warmed up. We're going to have more blood circulating throughout the body and through those muscles. So the stretches are going to be more effective following or after we do our exercise. And this is going to give us longer lasting results. So ideally a dynamic warm up before and then static stretching afterwards. You can also, one thing that's beneficial too is doing doing foam rolling before and including that in with your dynamic warm up. So for example, I'm going to kind of break this down into what a dynamic warm up should kind of look like with regards to upper body and then also lower body. So for lower body, one exercise, like for example, if I'm going to be doing a lot of squats for that workout, I'd want to be doing an exercise that mimics squatting. And so let's get this up here. All right. So if I'm going to be doing squats for that day, I want to be doing something that's going to mimic that. So it could be doing like box squats, okay, that are on an elevated surface. Okay, so not going quite so low, right? I'm stopping, coming back up. Versus like a normal squat, I'd be, going much lower than this box. So one way to warm up is just do elevated box squats, okay? And then progress your way into a lower position, okay? Another thing that you guys can do as well, loosen up the hips and loosen up the ankles, is get in a squat position like this, okay? And then what you're gonna do is you're gonna take your elbows and drive those knees out, and you can rock back and forth like this, okay? So I see a lot of people do it with their squats is they go like this. Those knees are collapsing in, right? We wanna make sure we keep those knees out, okay? And so using those elbows, and a lot of times it's because of hip weakness and then also hip tightness. So we gotta figure out what's going on there. And so one way to get those knees to go out if the hips are tight is kind of pry those open with the elbows. And then, we're working on the ankle mobility as well as we rock back and forth as well. Okay. So that's kind of how I would warm up with regards to if I was doing squats or lower body day, and then also lunges. Okay. Doing body weight lunges, static holds. Okay, you could do static holds like this. You could do stationary lunges like this. Okay, make sure we don't get that knee to collapse in. We don't want this knee to collapse in like that. Want to keep that knee out too. That's what I see a lot. And a lot of reasons for knee pain as well. So that's kind of what a dynamic warm up would look like with regards to squats. Doesn't have to be anything crazy or extensive. Okay, ideally about 5 to 10 minutes with that. So hopefully that kind of helps you guys out with the lower body. Let's see what other questions that you guys gave me last night here. And then again, if you guys have questions, what you can do is you can go ahead and comment on the video, because I can see those comments and I can answer them that way as well. What was another question? Right. Oh, question I get is, my doctor told me I have arthritis in my knees. Is there anything that I can do about that? And what's the best way to fix that, or if is it even possible? Because my doctor told me that arthritis isn't reversible. So first answer that, no, arthritis is not reversible. However, it can be fixed. Okay, and we can make it so you don't have pain with it. Are we gonna make that arthritis go away? No, but we can make it so it's not causing that discomfort. And you're like, well, how's that even possible? So we'll go back to where I was at, so you guys can see like the biomechanics of the knee and what I mean by that. So when we go into a squat position, we talked about how sometimes I see people do squats with their knees collapsing in like this, right? So you can imagine if I'm squatting, okay, or I'm every day throughout the day, I'm going to go sit down and my knees are collapsing in, that's going to redistribute that pressure around my knee, okay, and can cause some rubbing or friction and subsequent pain with that. So perfect examples, I see this all the time, is patients that come in with knee pain. I have them go do a squat, okay, or go do a lunge, and we got that knee collapsing in. All right. So if that knee's collapsing in, we're gonna get a lot of friction on that on one side of the knee versus the other. And a lot of times that friction is exactly where we have the arthritis. So you can imagine we're gonna have quite a bit of pain when we get that rubbing. Okay. So one way we can do that is change up the biomechanics of the knee, right? So it's not collapsing in like this. So we can get the knees to stay out here like they're supposed to when we do a squat. We redistribute that pressure, there's not so much pain, okay? So it's a combination of strengthening up the hips, loosening up the hips, sometimes at the feet too. We got to figure out what's going on with that. Because if my feet collapse in, okay, or if I got flat feet, my knees are going to follow in too, right? So rarely ever is it the knees' fault for having pain. It's a combination of usually hips and feet, what's occurring above and below the joint. And we don't want to just necessarily look at the knee joint itself. Yeah, there's a lot of moving pieces with things, right? So a lot of times I see people come in that have surgery scheduled 2 months from the time that they come and see their initial evaluation with me because their doctor told them physical therapy is great to do before surgery to help strengthen the muscles. They're absolutely right. Okay, the stronger you can go into surgery, the better. Okay, any surgery. And so, but there's been a lot of times where patients come in 2 months before, and I have them do a squat, and guess what I see? This. All right, this is actually what I love to see because this right here is totally fixable. Okay, if this is the reason that they're having pain, all I have to do is get them so they actually squat the correct way, strengthen up the right muscles, loosen up the right muscles, and their biomechanics are where it should be. There's been a lot of times where patients had that surgery scheduled, and by that 2-month mark, they're completely out of pain because we actually got them moving the way that they're supposed to be moving. Okay, our body is very efficient. It's built to last, and if we do the right things and move the way we're supposed to, it creates for longevity. Okay, and so you just need somebody to help guide you with that and make sure you're moving the way you should and that everything's in the correct alignment as well. So that's my spiel on osteoarthritis, and people thinking that it can't be reversed. Okay? You're right, it can't be reversed, but it can be fixed with regards to the pain that you're having too. All right, so hopefully that makes sense. And I think there was one other question that I saw or somebody sent in yesterday. Okay, actually one question that came in here is, I often get plantar fasciitis every time I work out. How can I prevent it from happening? So great question. This is something that's very, very common. Okay, so first thing I would ask is, one, is it only when you work out, or is it when you're throughout the day too, or is it in the morning? A lot of times our plantar fascia can get, so the plantar fascia is, for those that don't know, it's on the bottom of the foot. Okay, and so this can become irritated and can cause some pain. So a lot of times that's also with when we wake up in the morning, because our plantar fascia is stiff and tight and can cause subsequent pain there. So what I would do is I would look at your feet. How do you have good arches? Okay, is there some discrepancy with that? I'd ask, are you wearing inserts or insoles? And because if we're wearing inserts or insoles, that can do is essentially it's a brace. Okay, it can actually make the feet lazy. All right, and so if we're relying on inserts and insoles, our feet are going to be pretty darn weak. Okay, and if our feet are weak, it's not going to support that plantar fascia. Okay, and every time we go to take a step or work out or run, that plantar fascia is constantly getting stretched. So I want you guys to pretend that this is a poor model, but it's the best I got. So I want us to pretend that this is the big toe, and then this is the heel. Okay, and then we've got our arch of our foot. Okay, so if we've got a good arch here, okay, and then we go to step and our feet aren't strong enough to support the body weight or ourselves, then what happens is this elongates, okay, and that plantar fascia attaches from here to here, and every time we take a step, this is repeatedly getting stretched. You can imagine how this can become irritating, with every step, whether we're walking or running or working out, and that's why we get plantar fascia. Plantar fasciitis is that repeated stretching. So what we can do to loosen up these muscles is some stretching. Okay, this can be calf, so one thing that can help is calf stretching, because that helps loosen up the plantar fascia as well, because it's all interconnected. So one, I would stretch the calves. Okay, I would also take a ball and roll the bottom of the foot, all right, to help loosen that up, and some other stretches that will help stretch the foot as well. But those are the big ones. However, that's just treating the symptoms, right? We got to figure out why is this plantar fascia getting so irritated in the first place? Is it really your workouts? It's probably not your workout. It's probably that your body just doesn't have the tolerance for that workout yet. Okay, and so usually the root issue is actually the strength of the foot, and it can also be coming from the hip as well. So I'll kind of explain this a little bit. So when we're standing or when we go to take a step, okay, what can happen is that if that foot collapses in, we get that irritation, right? However, if we have a weak hip, okay, so we got a muscle called the glute medius. It's responsible for kicking the leg out. Okay. However, when we're in a squat position, okay, or when we're running, it's going to help prevent that knee from collapsing in, okay, like this. Okay. So what we need to do is strengthen up this muscle in a lot of cases. Okay, because watch what happens if my knee collapses in. You see what's happening at my foot? That foot's going to follow as well. So you can see how this is actually could be coming partially from your hip. So my thing is, I would see if you have somebody do an assessment on you and figure out where's this weakness coming from. Is it the hip? Is it the foot? Is it your shoes? Is it your insoles that you may or may not be using? And figure out what's going on there. Also, there's two different types of foot structure as well. So we got to figure out is the reason that you don't have a good arch possibly, is it because of the bony structure or is it because of muscle weakness? Okay. So one way to tell is I will have somebody lay on the treatment table with their shoes off and I'll look at their arches. If they have a good arch, okay, that means their skeletal system is where it needs to be with regards to the arch. Then I'll have them stand up. In a lot of cases, guess what happens? That arch flattens out. Okay, that tells me that the muscles aren't strong enough to support the skeletal system, and that's usually a large reason for why we're having some of that pain. Okay, and why that plantar fascia is getting so tight. So main thing is strengthen. Okay, and it's hard to give you an exact strength exercise because it depends on your level. Okay, because there's different levels to strength. Right, we got to have a good baseline, and then we also have to we can build up from that. Okay, and so I would start decreasing some of that pain is to do some of the stretching and that ball rolling underneath, and then get a good assessment done to figure out what's going on with that. Okay. Let's see here if you guys had any other questions. Hopefully that all makes sense. And if you have any other direct questions for me, go ahead and you can private message me as well. I'm happy to help you a little bit more that way too. All right. Any other questions from you guys? Okay, and it's happening mainly when you work out. Okay. So yeah, I'd make sure that you're stretching right after you get done working out as well. That's gonna be super important during that time to be doing that. All right. And then I also get a lot of blanket questions about, I think it's good that you were able to the person that asked the question that they had a specific diagnosis of plantar fasciitis. A lot of times I get a question where they're just like, I have shoulder pain, I have knee pain, or I have low back pain. I get that question a lot, and they're like, what's the best exercises for knee pain, shoulder pain, or low back pain? And so so my question on that is, it depends. Right? There's so many, the human body is so complicated, and there's so many different muscles, so many different ligaments, and so many different injuries that we can have just in the shoulder joint itself. So I see a lot of people that go on YouTube or go to the internet and they type in best exercises for knee pain, best exercises for shoulder pain, and it comes up with all these different exercises. All right, and the thing is, YouTube hasn't done an assessment on you. All right, YouTube doesn't know what your biomechanical alignment is of your shoulder. It doesn't know where your muscle's weak. It doesn't know which muscle is tight. It doesn't know these things about you. So there's no way that there's ever a best exercise for knee pain or best exercise for shoulder pain, because it needs to be individualized to you. Every human body is different. And so that's why it's important to get an assessment done to figure out what's going to be most effective. And I kind of use the analogy of, imagine that you're kind of like in a forest with a bunch of trees, right? And you're trying to navigate and find your way out, okay, out of pain, and you just don't know which way to go. And so what happens is we just try all these different exercises, hoping that one of them will work and help us to, figure out the right combination of stretches and strengthening to get us out of that forest. When in reality, what you need is a guide above the trees that can see the path that you need to be going, so it's much more efficient than trying to weave in and out of this forest and eventually hopefully try and find your way out. You can beeline that and figure it out much more quickly if you have a detailed assessment done and somebody that can help you with that. Because I see a lot of times people just try and figure it out on their own, for months on end. And a lot of times these exercises that are supposedly the best exercise for shoulder pain, or best exercise for knee pain or whatever, is actually making it worse, right? And on top of that, there's such a large variety of different exercises, okay, and intensity of exercises. First, you need to establish a good baseline, okay, a foundation to build off of, and then you need to progressively maybe making these exercises harder. On top of that, YouTube doesn't know what exercise you're trying to get back to, right? The way I treat patients, and one of the first questions I ask, like, well, what do you want to get back to? If somebody's coming in with knee pain and they want to be able to get back to squatting, that treatment plan looks completely different than if they came in with the exact same injury and were trying to get back to running, right? It also depends on what you're trying to get back to. And so it's important to get an assessment and get corrective exercises that are geared and tailored towards your exact injury with that. So that's my kind of spiel on that. See if any of you guys have any other questions. Okay, not seeing any here. All right, guys. So hopefully you guys found that beneficial. And then if there's any other questions that you guys have for me, go ahead and private message me, or you can message me through Truve as well. And I'm happy to help you guys out any way I can with regards to that. Keep your eye out as next week we may do another Q&A. And if you guys have specific questions beforehand, I think you guys will be able to put in the comments or in this group, and then we can direct those and address those during the next Q&A. And we may also do not a mobility class, but a workshop on knee pain, shoulder pain, low back pain, or anything else that you guys want, like a running workshop, squatting workshop, overhead mobility workshop, or how to work out without pain if I'm having pain with squats or shoulder press or something like that. So we may create like a poll in the True family group and figure out what topic would be most beneficial for me to come in and help you guys out with. But yeah, if you guys have any questions, don't hesitate to let me know. I'm happy to help.